Hey guys, this is Andrew from All Systems Performance and Chiropractic, and today this is a video in our patient education series, and what we're going to go over is the hip hinge and how the hip hinge or the inability to hip hinge can actually produce back pain or definitely aggravate it depending on the type of injury you have. So what we're going to go over today is, first off, I'm going to show you why that is important. I'm going to show you how to hip hinge, which will be very valuable to you, and then how you can incorporate it in your daily life to prevent or eliminate your back pain. So I'll show the spine model here first, just so you guys can have a pretty good idea. So here's our spine model, and the reason why hip hinging is so important is because generally we want to keep this nice lordotic curve, this nice curve into our in our back to prevent injuries. And the reason why we do that is because when we flex forward, you can see it puts some stress on these intervertebral discs. So especially people with intervertebral disc injuries, if you're bending through your spine a lot, what happens is it puts pressure, produces pain, sometimes even that sciatica down the leg. What we ideally want is hip hinging. This is our hip joint here. If you can move through the hips, that's going to prevent and eliminate a lot of your back pain. So where I see patients struggle with that most, or just a couple examples so you understand where that could come into play in the daily life, is if you are washing your face, brushing your teeth, doing your dishes. I'll see a lot of people bending at this lower back, and guess what happens when they do that? They have to get up out of that position, and man, is it difficult. I see them use their hands to get up just like that. So a hip hinge would be keeping that back nice and straight, and when you bend with your hips, what it does is it puts your erector spinae muscles and your glute muscles at a very advantageous position so that you can actually get up a lot easier. And I don't see people using their hands. I'll see it a lot when I see patients in the waiting room. And what they'll do is they'll be slumped over in the waiting room chair just like that, and I tell them to come on in, and what they do is they use momentum. So they come up like this to get up out, but we're not in that nice position to hip hinge. So what do? Again, they resort to the hands, and they do one of these, and that causes a lot of back pain. So we're gonna get into teaching the hip hinge. Two ways I'm gonna show you. One way I do is actually start up against a wall, and I usually tell people to start maybe 8 to 10 inches away from the wall, just like this, with their butt facing the wall. And I get them to start by imagining that there's this broomstick here that's pushing their hips backwards towards the wall like that. So you're imagining something swooping through and hitting your hips directly from a anterior posterior direction. Put the hand on the chest, and you can even have the hand in the small of your back, because you'll feel that bending and you don't want that. So hand on the chest, hand on the back. You can spread the feet out to what's comfortable. You can bend the knees to whatever's comfortable for you. And I want you to push that butt back towards the wall just like that, and then stand up. So I'll watch you do a few reps, or watch me do a few reps rather. And what we're looking for here is very little flexion in the lower back, standing up and back. Hips are going directly back. Here, I feel my muscles working. I feel my glutes working. I feel my lower back musculature working, but that's good. What people will do is they'll start going forward, and then they can't get that back to the wall, or that butt to the wall, and this is where it's very difficult to get up out from. So you can even do that as an exercise. Eventually you see people at the gym, they actually will load these exercises. They'll put dumbbells in their hands, barbells in their hands, they'll spread it out, they might bend the knees a little bit more, but they go down and then up. That's good, that works, it works the muscles of the back, doesn't, again, compress those intervertebral discs, doesn't cause back pain. Another way I get people to do it, good cue for teaching it, is using a broomstick or a dowel. And what you can do is actually place it on your back. And when you place it on your back, I like people to keep apart on their buttock, on their mid-back, and their head, and then try to perform the hip hinge. If they're doing it right, you'll be able to keep that nice straight line between those 3 points of contact. We'll do a few reps here. So again, hips are going back, maintain those 3 points of contact on my buttock, on my mid-back, and on my head. Forward. Again, you could do this as an exercise a few times a day, just to ingrain that motor pattern. Again, using my glutes and my back musculature instead of putting those forces through my lower back. So keep an eye out for our future videos. We're gonna have a couple videos on how to actually use that as an exercise, teach you a couple ways in which you can deadlift, a couple ways that you could really load that exercise to get a very good workout. But my goal for you today is see if you can get those motor patterns or that hip hinging pattern, get it down pat at home. So try the wall exercise, maybe grab a broomstick and see if you can do a few reps. Once you can do a few reps, I want you to focus on doing it in your day-to-day life. Again, bending forward, washing your face with that nice hip hinge pattern. People will often ask me, how do I get down to the ground? How do I tie my shoe if I can only bend through my hips? And I tell them, you can bend through the hips and the knees. So what it is maintain that nice hip hinge pattern and then bend your knees. I get down, I can tie my shoe, and you can see my back is in a very nice position. I can tie my shoe, I can feed the dog, I can pet the dog, and then when I stand up, I'm using my legs and my lower back muscles to stand up, just like that. Instead, what people do is they reach, bending through the back, they get to here, they go down, and then yes, it's very, very difficult to get up from this position. They have to use the hands or come up or grab something there. So, hope you guys learned a lot from that hip hinging video. Try it out at home, and again, stay tuned for more educational posts and exercise videos. Thanks for watching today, guys.